South Africa has reported a sharp rise in the number of coronavirus infections. Nearly 11,000 new cases were reported on Saturday. That's the country's biggest increase in a single day since the start of the pandemic. The government is urging people to respect social distancing and other measures to halt the spread of the virus. But as DW's Adrian Creech reports from Cape Town, it's proving difficult for some communities.
Cape Town, one of the epicenters of the coronavirus pandemic in South Africa, but there's little evidence of it in this suburb. Few abide by the mandate to wear a mask, and social distancing is unusual.
The life must go on like normal, you see. I was positive and I isolate myself at home. So nothing was wrong with me.
No, I'm not afraid because I cover me every day under the blood of the Lord, you understand? So I'm safe. So I'm not scared because if I die, I know where I'm going to.
But poor, overcrowded neighborhoods is just where the virus is rapidly spreading. Many people here feel the economic fallout of the pandemic is a greater threat than the disease itself. That's why a COVID-19 mission from the Health Ministry is trying to convince potentially infected people and their contacts to enter quarantine.
It is easier to protect your loved ones and everyone else by going to isolation and quarantine to protect yourself and the family. But in this environment, when you probably are sharing the room, the bed with all others, it becomes difficult. You end up infecting them. So that's why we're saying that we have got hotels where we take you.
The government has poured massive funds into field hospitals and quarantine rooms. But while more patients go to the hospitals, the quarantine rooms remain empty. People who refuse to go into isolation, how big of a problem is it? Are we talking of huge numbers where this is happening?
It's huge because with, I think it was about 10,000 so beds that we prepared for the quarantine and isolation combined. Out of those, the last time I checked, there was only around about 2,000 that were activated. But we find that in those areas, it's the people who don't want to. Of course, the law does say that you have to issue court orders, but at what extent?
Few people seem interested in the awareness-raising campaign in the township, even though the region is a coronavirus hotspot.
My mom tested positive, so she had to isolate. We live in a two-bedroom apartment. So for her to isolate, all of us has to stay in one room. You see, so we couldn't get in contact. And there's kids around, so it's difficult.
Why didn't your mom go to one of the isolation facilities then?
It was better because we took better care of her. So we were scared, like what is going to happen if she's not with us.
And many people here are too afraid to leave their homes for extended periods due to the high crime rates. In places like this, self-isolation is obviously very difficult. The young lady we just talked to lives with 9 people in a 2-bedroom apartment. But many people here still do not really take the threat of the virus serious, despite the fact that Cape Town is currently experiencing the first peak of the pandemic in the country.
And DW's Adrian Creech, who filed that report, joins us now from Cape Town. Good to see you, Adrian. South Africa reported around 20,000 new coronavirus cases over the weekend. Is the country headed for a second lockdown?
Well, as you know, South Africa had one of the strictest lockdowns worldwide in the initial stage of the coronavirus outbreak here, when infection numbers were very, very low. And the president here said himself that was the bazooka, the strongest weapon that the government had. And some people here are wondering now if possibly the strongest weapon was used too early. Yes, it gave the government time to prepare the health sector. But what also happened in the same time is that the overall readiness of the population for strict measures against the virus is gone down. There's been a massive pressure over the past weeks to reopen the economy, and now we have restaurants opened, schools are open again, religious gatherings are allowed again, and this is all happening in the time where we're seeing, the first peak coming closer and closer. But at the same time, yes, there is pressure to come back with another lockdown in local areas like Gauteng, for example, the area around Pretoria and Johannesburg, where local authorities are already asking the national government to consider another lockdown.
How is South Africa's health infrastructure coping with this surge in infections?
I would say very different depending on the provinces and regions. Here in the Western Cape, it seems they are quite prepared. A lot of field hospitals were set up. You've seen that in the report. But in other regions, it looks more problematic. In Gauteng and the Eastern Cape, for example, two of the other epicenters of the pandemic in South Africa, there still needs to be done. You have a big gap in hospital beds, in intensive care units. So a lot of work needs to be done there. But you also have to remember that the South African public healthcare system has been overstretched for years. I talked to an official in the health ministry last week, and he told me that's been the reality for us. Remember, South Africa has been facing massive health challenges, high rates of HIV/AIDS patients, diabetes patients, tuberculosis, for example. And this, of course, with COVID now puts additional pressure on the health system. On the other hand, you have officials saying, well, it might be also a chance for us because we're experienced in dealing with health crisis and scenarios. And there's one, well, a little bit positive thing maybe as well. If you look at the death toll, it's much lower than initially expected. South Africa has round about the same number of COVID cases like Germany, but only 3,200 people died of COVID so far. In Germany, the number is 3 times higher.
Adrian, thank you so much. That was DW's Adrian Krisch in Cape Town. Let's bring you up to date now on some of the other developments in the COVID-19 crisis. Hundreds of scientists are calling for the World Health Organization to revise its recommendations on combating the virus to focus on airborne transmission. Saudi Arabia has banned gatherings between those attending this year's Hajj, the annual Islamic pilgrimage, to prevent the spread of the coronavirus. People in England appear to have, for the most part, behaved themselves as pubs reopened over the weekend, according to Britain's health minister. And Ireland will ease quarantine restrictions on incoming travelers starting July 20th, based on a green list of countries with low infection rates. India has announced that it has nearly 700,000 coronavirus cases, making it the 3rd hardest hit nation in the global pandemic after the United States and Brazil. The number of infections in India is also expected to rise for several more weeks, and experts predict the 1 million figure will be passed this month. The country's major cities are bearing the brunt of the pandemic.
A mammoth facility to face a mammoth challenge. At the weekend, Delhi inaugurated a 10,000-bed hospital to treat coronavirus patients, one of the largest in the world. This even as India eases restrictions, balancing the need for a return to normality with the needs for public safety. People are learning to live with the virus. We're scared, but we still have to go out. Everyone in the world's worried about dying, but we still have to work. What's needed is awareness. If people are aware, then we should be able to control the spread. With infections around the 100,000 mark, Delhi is one of the cities hardest hit by COVID-19. But new infections are surging, not only there. A fresh spate of cases in the city of Agra forced authorities to reverse plans to reopen India's most famous landmark, the Taj Mahal. The reopening would have seen just a fraction of visitors return, under tight hygiene and physical distancing rules. India's coronavirus tally is predicted to reach more than 1 million before the end of July. How long the country's monument to love will remain closed, well, that's less certain.
And DW's Manira Chaudhary joins me now from Delhi with more. Manira, why is India having such a tough time getting a grip on this virus?
Well, Terry, let me begin by saying that this kind of rise in the number of cases was expected by the medical experts initially when a couple of months ago when they were being interviewed when the virus had started spreading in India. Because we need to also understand the kind of population and the population density that our country has. This kind of local transmission is very much possible. And apart from that, we have come out of a nationwide lockdown to a large extent. There has been a lot of relaxation in those rules and regulations and restrictions. So life is coming back to its usual state of affairs. And so human-to-human interaction has, of course, also increased, leading to this kind of transmission. But critics also say that the initial few months when the lockdown was implemented, the Indian authorities could not carry out contact tracing as well as they could have. The focus was still for a long time entirely on people who had just traveled, who had come back from other countries, and their immediate family members and the people they may have directly interacted with. But beyond that, a person-to-person interaction was not taken into account for a long time. This is what the critics had to say. And apart from that, our testing numbers are still low, and they were much lower if you talk about the past couple of months. So that did lead to a possibility of a lot of asymptomatic cases being left out who survived the virus, but who could have been possibly carriers of the virus, spreading it far and wide. Take, for example, the migrant workers. We saw a mass exodus after the lockdown was implemented, and possibly these workers also took the infection from big cities to smaller towns and villages, thereby spreading the number of cases.
Okay, well, infection numbers are clearly rising. Do authorities have a plan to tackle those rising numbers?
Well, if you talk about the nationwide strategy, then one thing is very evident, that a nationwide lockdown, again, is not an option for India, considering what it did to our economy, which was already lagging behind even 6 months ago. So at the moment, the national government is coordinating with different states at its own level, but different states with their own local governments are also taking matters into their own hands. For example, different states, whether it's the southern state of Karnataka or eastern state of Assam, they are taking calls of implementing lockdown in particular regions where a sudden surge of cases might have been seen, or some event took place where there was a large gathering and a couple of positive cases were detected. So that is what they are trying, statewide. For example, Delhi government has very openly projected that Delhi, the capital city, may reach a case count of 500,000 by the end of July. So what they are trying to do right now is, of course, maintain containment zones where there are more cases and increase testing camps, organize regular testing camps to detect cases faster so they could be quarantined or put in isolation. But apart from that, the focus right now is to increase the healthcare infrastructure to the extent that we can handle that caseload.
Manira, thank you very much. That was DW's Manira Chaudhary in Delhi. Let's take a look now at some of the other developments in the coronavirus pandemic. In Australia, authorities will close the border on Tuesday night between the country's two most populous states, Victoria and New South Wales. That's after a spike in COVID-19 cases in the city of Melbourne. It's the first time that that border has been closed since the outbreak of Spanish flu 100 years ago. Spain's Armarina district along the northwest coast will go back under a 5-day lockdown after a spike in coronavirus infections. Around 70,000 people will be affected. Local authorities have traced the outbreak to reopened bars. The world's most visited museum, the Louvre in Paris, is reopening today after being closed for nearly 4 months because of the coronavirus lockdown. But with many foreign tourists still unable to visit the city, it'll be anything but a return to business as usual. However, the reopening 2 weeks ago of another famous monument in the French capital, the Eiffel Tower, shows there are reasons to be optimistic.
It's still as breathtaking as ever, getting close to these 10,000 tons of iron. The tower was built for no other reason than glory, an engineering wonder by Gustave Eiffel, designed to look like lace. Since its opening in 1889, it has been closed only during the 2 world wars, and now for 100 days due to the coronavirus pandemic. There have been few visitors since the reopening, which suits this family just fine.
Where are you from? Well, it's a difficult question. I'm from Poland, my husband from Italy, and we live in Belgium.
The couple thinks it's a very good time to visit.
It's such a big symbol of Paris, and it's the first time to come here with the whole family. And also, currently, it's so calm in Paris, it's a good time to be here.
They are going up on foot. Only one of the lifts is operating so far, and at much reduced capacity. But more of the tower will be opened in the coming weeks. Visitors will have access to the summit from mid-July. But climbing the 704 steps to the second floor isn't bad.
Yes, we've made it!
How do you feel?
Good, it was good. Was it good, kids?
Yeah.
Yes?
A bit hot under the mask.
Yes, the second part was a bit tougher. Wow.
These days, crowds can be dangerous, and the tower's managers are doing all they can to prevent it becoming a COVID infection zone.
We implemented a couple of measures, such as social distancing by 1.5 meters, and with a mask. The face mask is mandatory here.
Though some were taking them off for a quick selfie.
Finally, we have a limit of 1,400 people, when normally it's 5,000 people.
Restarting small then, but those who do come this summer will have the unusual feeling of having the Eiffel Tower almost to themselves.